Well, hi again, everyone. It's great to have you with us. Happy Tuesday and welcome to the Hunt Institute's Early Efforts web series. My name is Dan Worry. I'm the Senior Director of Early Learning at the Hunt Institute. For those of you who may not be familiar, the Institute was created by Jim Hunt, the four-term governor of North Carolina. We are an education policy resource to governors and state lawmakers and other state elected and administrative officials across the country. We cover the full waterfront in terms of education policy from prenatal through workforce, but on early efforts. We dedicate our time to the early childhood portion of the spectrum and are so glad to have you with us. We've got a great session today. A couple of housekeeping notes as we get started. First is that, and I see it's already happening even unprompted, please jump into the chat, introduce yourself and get acquainted with one another. It's great to see the community that is forming through these broadcasts, and we're always excited to see that conversation happening. The other thing you can do down at the bottom of your screen, you'll notice that this session is closed captioned, and so if that is a service that would be helpful to you, there is a closed caption button at the bottom of your Zoom screen there that you can click on to find settings to view all of the closed captioning. Want to encourage you as well, we will later in the hour pose some of your questions to the panel. Invite you in particular not to use the chat function for that, but to use the Q&A function. You can see those of you who are watching the chat, there's a good bit of activity there already. And so to just sort of help us tease out where the questions are and make sure we don't miss your questions, if you use the Q&A function, then we will we'll plug right into that. I'm going to screen share quickly. I did this last time around and it worked well to do it at the beginning. So I'm going to quickly share my screen and I hope share with you a couple of upcoming events. Next month, we will be together again on March 1st at 2 p.m. Eastern Time. Dr. Dana Suskind, who is the founder and the co-director of the 30 Million Words Center, TMW Center for Early Learning at the University of Chicago, is going to be joining us. Dr. Suskind has a new book, Parent Nation, which will be published in early August, and she will be with us to talk about that book along with Yoli Flores, who is the national campaign manager for the TMW Center there at the University of Chicago. Really looking forward to that conversation and hope that you'll be able to join us on March 1st. And then on April 5th, as Congress is debating the possible expansion of universal pre-kindergarten, we're going to be talking with leaders who are helping to build really robust mixed delivery pre-K systems around the country. We'll be joined by Secretary Barbara Cooper of the Alabama Department of Education, my former colleague, Martha Strickland, who is the State Director of 4K at South Carolina First Steps to School Readiness, Dr. Stephen Barnett of NEAR, and also Gigi Weisfeld of NEAR as well. So we're glad to have them and hope that you will join us for those sessions as well. I will, throughout the course of the hour today, drop the registration links for those discussions into the chat, so that you can pop over and get registered. So with that, why don't we go ahead and kick off today? We're going to talk about childcare. Obviously a lot of news about childcare here recently. The field is, precarious to begin with, and certainly in crisis during the pandemic. One of the things that we know needs to happen in order to solve the fiscal challenge that is posed of the industry is to look at how childcare is funded. The real question being whether it is adequately funded to provide the kind of quality care that we need. Lots of states are looking at this. You may be aware that through the proposed Build Back Better legislation that Congress is undertaking, one of the things that they are proposing is a new methodology for states to look at what this service ought to cost. They're asking states to go through a process called cost modeling that will look at not just what the market can bear, but what are the real costs of quality, including paying a living wage to child care workers in the field. And so today we're going to have a conversation about a state that is really leading the way here, New Mexico, and excited to talk about the great work that is that is happening there, and with some of the leaders who are helping to pull that work together and support that work. We are excited to be joined by Secretary Elizabeth Groginski, who is the leader of the New Mexico Early Childhood Education and Care Department, Simon Workman and Gina Capito, who are the principals and co-founders of Prenatal to Five Fiscal Strategies, and Daisy Lira, who is the executive director of the Hive Education in New Mexico. So glad to have all of you with us. And Simon, as we kick this conversation off, you and I were talking a few minutes ago. This is a little bit of a specialized part of the early childhood world. Some who maybe are even working in childcare may not be super familiar with sort of the state level logistics of how this all works, where this money comes from for states to help to provide childcare subsidy, for example, and how states go about setting the rates that they pay out to providers. I think that's important context, maybe as ground setting before we talk about the ways that the group of you have been sort of innovating on that existing process in New Mexico. So Simon, maybe ground us a little bit in the background of this work. Where are the dollars coming from, and how are states helping to decide what they pay to centers to begin with?
Absolutely. Thanks, Dan. And great to be here with so many of you today, and see so many familiar names in the participant list, and excited always to talk about cost modeling. Any of you have heard me talk before know this is an issue that's very near and dear to my heart. To sort of take from what Dan was just saying, before we get into kind of what New Mexico was doing as kind of the alternative, just kind of grounding in where we kind of have been in this system for so long. So, the public funding, the main public funding for childcare in this country is through the Childcare and Development Fund and the Childcare Development Block Grant, CCDBG. And, since, historically, states set their rates of actually how much they pay childcare providers from that subsidy system based on a market rate survey. So they go out, they conduct a survey of all providers in the state to find out what are they charging in tuition. And then they use that to inform how they will set rates at some percentage of that level. And, historically, it was supposed to be at the 75th percentile of the market rate, so that a family who is accessing childcare with the subsidy can access childcare from most providers in the state. Now, since the 2014 reauthorization of the Childcare Development Block Grant, states have had the option to set rates by what's called an alternative methodology, and that is taking account of cost. So rather than just looking at the market prices of childcare, actually looking at what it costs to provide childcare and using this cost estimation model idea. Now, the District of Columbia, where the secretary was before in New Mexico, was the first place in the country to actually do this a few years ago now. And it's not been until New Mexico now in 2021 that we actually had another state come along and do this. And honestly, that's because it costs more money to pay based on cost rather than price, right? We all want to do the best for kids, but at the end of the day, there is a question about money and how much money there is to do this. And the reason that this is so important, and the reason we should be talking about moving to setting rates based on cost rather than price, is that the approach of using the market rate survey and looking at current market rates really embeds inequities. The inequities that exist already in the system, in the private market, kind of then move over to the public market. And providers are left disincentivized to provide care that costs more than families can afford. And so what you see all of those disparities around, if you're in a low-income community where tuition rates have to be low in order to attract families, you get a low reimbursement rate. So, for those providers who have the least resources, they get the least in public funding as well. It's also a big issue with age. We see that the true cost of infant and toddler childcare is really beyond what most families can afford to pay. Even, middle income, somewhat well-off families, infant and toddler childcare is expensive. So in order to attract families, providers have to set tuition rates lower than it actually costs. And they offset that by serving older children where families can afford closer to the actual cost. But what that means is then when you report your rate for infants and toddlers is below what it actually costs. So then the subsidy you get back is below that. And so what you see there is, if you're a provider, you serve a 4-year-old, the subsidy could be closer to actual cost, but you serve an infant and it's really far away. So moving to setting rates in this cost modeling process, you actually are saying, take all of those problems away, take away what families can afford to pay, take away what community you're in, and actually say, what does it actually cost to provide the service we actually need? And that's what New Mexico did, and that's what we're really excited to talk to you about more today.
Fantastic. And Simon, talk a little bit about the intersection between market rates and quality in particular. I think important to recognize that the market rates maybe what centers are getting today, but certainly are premised in most cases on the idea that staff are going to be making minimum wage or a little more.
Yeah, I mean, we often say the childcare market is broken, and this is a great example of that. In a market that was functioning properly, you would say, we're going to offer high quality childcare and we're going to charge what it costs, and parents will pay for it because they appreciate quality. What we know is parents appreciate quality, but they cannot pay for it. You might say, I want my teacher to make $40,000 a year, but if you literally cannot afford to pay for that, you are price constrained as a consumer. So what does that mean? If you're a provider, you end up paying teachers the sort of market going rate for teachers, for educators in your program. And so that often, unfortunately, is low wages. And when you look at the budgeting of childcare programs, 70% of the cost of a program is personnel. And so when you start to say there's a gap between what it truly costs and what the revenue providers can pull in, where does that gap get filled? Unfortunately, it gets filled by underpaying the childcare workforce. And that has been such a problem. So even though there are lots of high quality programs out there, they might be paying a little bit more, but they're not paying what those teachers really deserve, which is why you see high turnover in early childhood programs. It's why you see right now a huge labor crisis, in childcare, more so even than in other industries. And the benefit of cost modeling is you're taking away that what can families afford to pay at high quality levels, and say, if you're requiring this experience and these credentials at these quality levels, you can say, this is a salary we're going to build into that model and actually set a rate that allows providers to pay that salary.
Terrific. And Gina, let's turn to you. Simon's done such a lovely job of sort of setting up the status quo, if you will, sort of how things have traditionally worked in the childcare market. You and he have come together and formed Prenatal to 5 Fiscal Strategies, which is an organization that is helping to support states here. Talk about the alternative approach. What's the way that you are helping states to maybe re-envision how this all works?
Sure. Hi, everyone. Great to be here. As Dan put it, it's really the alternative, right? The alternative methodology, especially when we're speaking specifically about the idea of how we set rates for publicly subsidized childcare, is an allowed approach. While the traditional approach under the market rate, which is based on the price that programs can charge, the alternative methodology uses the actual cost of the service. And by pivoting to that approach, state systems then, to Simon's point about cost, have to then be prepared to think about how they're going to raise rates and address the fact that what they're going to find in all likelihood is going to be that the actual cost of care is greater than what the market rate is telling them the price of what families have been charged, especially historically what families have been charged. So it isn't just about as simple as saying we use a cost model. And I think that the Secretary and Daisy will both reflect on this here when they begin to share more about the New Mexico experience, that there's a lot to the system of how you look at this, that creating a cost model for a state is just one step in taking the alternative approach and really understanding cost. Then what you do with that to actually set rates, but even bigger, change your policies, analyze all of your policies from that basis of cost information, and really begin thinking about how the whole system needs to pivot or shift in order to better address understanding not just the current true cost of care, but where you're trying to go. And that's a really significant consideration in cost modeling. Market rate surveys and most of our kind of way that we've done this previously is very point in time. What does a program charge a family in 2019, in 2020? And that you take that snapshot, so to speak, where a cost model, and using the alternative methodology approach to using the cost of care, you build a tool that then the state can use to understand the reality for providers currently. And that's one of the things that you'll find if you have the opportunity to take a look at the cost estimation report for the state of New Mexico, which we're going to share the link to the report in the chat today as well. There's a lot of great information in there, but what you'll find is what the cost model does is initially it compares what the actual cost of care is for New Mexico childcare providers across all different settings, center-based family childcare, out of school time or after, before and after school care settings, to those market rate established subsidy rates. But what it's also telling you is what is the reality of the real cost of delivering the care? What is the gap between what subsidy is paying and what that real cost is? And what does that real cost look like across the different levels of quality, which is of critical importance to understand that if we're driving to higher levels of quality, we need to understand that quality costs more, right? We don't want to be stuck at a certain level. And also really acknowledge and understand that where are you headed? You have a vision and a set of goals, which Secretary Gerginski will do a wonderful job of sharing some of how that's part of their system in New Mexico, is to set a vision and a North Star of change. And how do you then in your resource tool or this cost model build in those features? So build in aspirational salaries, build in comprehensive compensation that includes discretionary benefits like health and retirement for staff, that includes sick days and vacation days for staff, right? That this is not just here's what it costs to do the way we currently operate, but where are we trying to head to grow the field and to strengthen it? And then how do we ensure that in using a cost model, you continually look at those aspirational levels and have that inform your planning year over year and have it be about that long game? You have rate increases in 1 year, but that's just one step. It's a much longer term process. And I know that Secretary can reflect on that from both the District of Columbia, having worked with the DC in 3 years of doing cost models. So like this is a long game process to improve the system, and that this is just the first step in it, and how the whole system works together to respond to and continue to strengthen the cost model is a real critical importance to what happens next for any community.
Gina, thank you. And so, Secretary Gerginski, let's jump over to you. Both Simon and Gina have mentioned, that DC under your leadership was sort of the innovator in this field, and now you've obviously brought this to your work in New Mexico. Talk a little bit about the vision for why you felt this was important, even in DC, what you saw and why you felt like now was the time to bring this to New Mexico.
Thank you, Dan, and good afternoon, everybody. I'm so glad to be joined here with Simon and Gina and Daisy. Great question. And I think most importantly, one, my husband, Scott Kraginski, was on the House Education Workforce Committee when they reauthorized the Child Care and Development Block Grant and ensured that cost estimation was an alternative for states. So I did feel a passion from a family sense to be true to that. But DC was a perfect place to do it because they were so advanced in what they had been thinking about in the early childhood system. But right away, we realized some things that we realized in DC was that most of our family childcare homes were under enrolled. So these are the things and I just want to speak to kind of what both Gina and Simon were saying, is that the cost estimation requires you to take a look at your entire system. You cannot complete the cost estimation without understanding where are people's enrollment levels, what is your quality rating improvement system, what is it driving towards in terms of costs, what are your licensing regulations? In DC, we have some of the best. They have some of the best licensing regulations. Very low group size, very high ratio, good ratios, health and safety. So you have to look at your licensing regulations and see what is expected of a childcare provider in your state, in your area, to implement that. If they're really doing it and they're making sure they're meeting all the regulations, what will that cost them? Now you bring in your quality rating improvement system. What are you asking providers to do to raise up 2, 3, 4, 5 star? What are the cost drivers in there? And so it's a great opportunity. And the other part about it is that you don't do it in isolation. You're doing this in community. You're talking with your childcare resource and referral. You're talking with your family childcare providers, your centers, your early childhood advisory council. They're checking your methodology. They're weighing in on what are the quality indicators that are driving the costs in the system, and what are the revenue streams that are available. So I think in DC, we realized as we talked to family child care, they were mostly all under enrolled at about 60%. Well, we knew we could never set a rate that would not be responsible to set a rate that would allow family child care to be at 60% because we need care. So we want them at least at 85%, 100% if they could be there, but 85%. And so that drove a policy decision to create a shared services network. We also saw in DC that our rates were not aligned. We changed our rates when a child turned 2, but nothing changed for the provider. They still had to have the same number of teachers. They still had the same number of children in the classroom. So we were able to make that change in our rate and create an infant toddler rate instead of having an infant and a toddler. So those were some things early in DC's first iteration. Since then, it's become even more advanced. In New Mexico, similarly, we were able to, we have one rate for the whole state, which may seem odd that we're such a geographically diverse state, but that was the way it was. And actually the cost model, as Simon and Gina did their work, saw that there wasn't much differentiation in terms of hourly salaries across the state, which, as he said, that's the biggest driver of your costs. So I think the things that I just want to really emphasize, and please ask all the state leaders who are here today to really take this seriously, because this is what has hampered our system and our advancing our work. And Daisy's going to speak to it as someone on the ground who has to make this work every day. But we have to get serious about no longer just funding our prenatal to 5 programs and our childcare in particular based on whatever's available, but actually on what it costs to deliver the quality care. We're asking our business owners in the community to deliver to children and families, and we're expecting results, but we have to fund that. So I definitely want to turn it over to Daisy for her perspective.
Great, Daisy, weigh in on your perspective as a provider. What has what have New Mexico's recent changes meant to you?
Well, first of all, thank you so much for having me and allowing me the space to represent myself, my center, and also childcare's providers around New Mexico. The centers I operate are subsidized at 100%. So this means that my budget, my payroll, my benefits are dependent on the subsidies alone. Quality materials and supplies are also a must, and it's for the standard of care that we provide. But they are compromised when the subsidy is not enough. So recently, the new administration and early in the ECECD department, they gave us an increase that we had not seen in many, many years. So thank you so much to Secretary Groginski that she came and she's changing things over here. I was able to give for the first time since 2007 that I opened my facilities a 3% COLA raise across the board for all the 60 employees that I have. Usually it's based on performance, it's based on education, and but this time around I was able to give 3% because of that increase of subsidies. And we are extremely grateful for that hard work. But we do need further substantial funding, and it is necessary because inflation alone in 2021 was 7%. So, it's important to understand that, subsidies for a childcare that is 100%, operating and its subsidies, it's a big deal. It's something it either makes us or breaks us. So.
Oh, go ahead, Daisy.
Go ahead.
Yeah, I was just going to say that that is such a great point, and I'm so glad to hear that you were able to do that for your staff. One thing I just want to make clear is that we used our ongoing CCDF funds to make this rate increase. Again, we used the cost estimation model to inform our rate setting and said, what funding do we have available? So this was not federal relief dollars that we did to to increase the rate. What we did do, though, is we realized as we were increasing the rates, is again, childcare is becoming out of reach for more families. We then used the relief dollars to expand eligibility up to 350% of poverty. So more families can get access to the assistance. And then, of course, what we've seen through that, and I want Daisy to speak a little bit about how she's used her relief dollars to help supplement this, is that our co-payment structure has not been revisited in the state for almost 2 decades. So that is running into problems to what Gina and Simon were saying is providers are charging in low-income communities, so whatever families can afford, that as our co-payments, as we expanded eligibility, co-payments were sometimes more than what a provider would charge. So again, it just demonstrated that we have more work, and that's the vision that a cost estimation model allows you to do. But Daisy, I think, did a nice job marrying her relief dollars with our expanded eligibility. And if you want to talk a little bit about that, Daisy.
Yes, so why I started seeing, parents coming in, and there's a struggle. There was a struggle, I mean, everywhere, I believe. So a lot of parents would come in and tell me, you know what, I did qualify for the program. However, my copayment is pretty high. And I said, you know what, I think it's important to use these dollars that, the relief dollars for good use. And so we decided to create scholarships. So the scholarships would take care of those high co-payments that these parents cannot afford, because they cannot afford. Sometimes the co-payments would be higher than what I actually charge as a private provider. And so people would come in and would tell me, and I said, no, it's okay, get the help and I'll help you with the scholarship. So that's how I was able to help them close that gap with creating those scholarships. And that's something less that the families have to be thinking of, in regards to funding and having these children. Because another thing was, well, I'm just going to take my children off of childcare and I'm going to leave them with grandma. And I said, no, you don't have to. You don't have to do that. You could, and people would tell me, but I don't want to. My children are learning so much. I know they're well taken care of. And I'm like, you don't have to. This is why we're here for, and this is why the relief dollars are here for as well.
Well, let me remind you that we're going to transition here in just a moment to taking some questions from you in the viewing audience. So use the Q&A function down at the bottom of your Zoom screen to answer your questions. Here's maybe a group question for you all, though. Maybe we start with Simon and Gina and then transition to Secretary Gruginski. Give us a little bit more context in terms of, like, Gina and Simon, as you approached this analysis in New Mexico, what are some of the high-level findings sort of in the report? What did you learn about the existing rate structure, and maybe how far off was it? And then Secretary Gruginski, maybe you could follow up and talk a little bit about what New Mexico has sort of done tactically as a result of this work.
Yeah, sure. Let's jump in with some of the things that reinforce what Simon was sort of outlining around the idea of the broken market. I mean, some of what we found in New Mexico is a state, like many of yours, that had tiered reimbursement. So there was already a process in place in the state to say that at higher levels of quality, we should pay more. So reimbursement rates were tiered and higher for those higher levels of quality. One of the big things that we found, and this is consistent with what we know about this idea of how are we incentivizing or disincentivizing quality, is that those higher rates of reimbursement were not keeping up with how much higher the cost was at those higher levels of quality. And that's something that we know that when we oftentimes set payment rates or set contract amounts, that kind of without using cost of care, do we know that the amount we're paying actually keeps up with what it costs to do the work? And that was something that the study bore out. It also bore out that the higher cost of care for infants and toddlers is dramatically higher and dramatically underfunded compared to, even in a case where the rates for infants and toddlers were higher than the preschool rates, the gap for the amount paid for infants and toddlers compared to the gap paying for a preschooler was larger. So again, sort of not only disincentivizing a mixed delivery or having multiple ages of children in a program, because if you're a program and you're trying to figure out how do I get the closest to making myself whole, serving older children is going to get you closer there. So we know that we're disincentivizing programs from serving infants and toddlers, which in a country with significant deserts of infant toddler care, that's not something that we want to be doing with how we set rates. So those are a couple of the big findings that really reinforce a story, I think, that we hear across the country in states that are engaging in this work.
I would just add briefly on family childcare, one thing we found is what you see a lot is that the rates that family childcare providers set are usually not inclusive of them having a salary, right? They often what we see is like this, the tuition rates in family childcare are lower, but that's because the family childcare provider is not paying themselves a salary, they have a lot of shared business costs. When you do the cost modeling, we build in a salary for the family childcare provider, and whether it's paid as a salary or it's business income, there is at least money included in there to say, if family childcare is to be a robust, sustainable part of this system, she needs to be compensated for the work that she is doing. And so that's a big change. So when you saw the rate changes and the cost model changes, saw huge increases on the family childcare side, because it goes from rates that didn't include any salary to us actually including a salary and benefits in that model.
Yeah, that's exactly right, Simon. And that was a huge learning, I think, for the community. I think for family childcare, we were very excited because we know we want to grow family childcare in the state. And if it is not a viable income and there isn't an incentive to go into this business. So as we looked at that, we said, okay, we had different discussions as we looked at the cost model results. We wanted to make sure we were still incentivizing infant and toddler care. So we discussed, should we just pay a family childcare? I mean, it's one person serving all these children, but we had to think about that. We don't, if it's easier to serve 3 and 4-year-olds and everybody's paid the same, then would we disincentivize infant toddler care? So those are discussions you get to have. Once you have the cost model, you have it with your early childhood stakeholders, and you really think about what are those cost benefits, things that you're weighing as you make the decision about where to set rates. But being able to put a salary into family childcare rates was really important, and we use the lead teacher salary in a center base as our marker. The other thing we've done, because we had a legislatively mandated report to do a 4-year finance plan for our department, that Gina and Simon were able to continue to support us. And so we put a base salary in at $12.10 minimum wage. And that was because that was the highest minimum wage in the state of New Mexico at the time. And so some municipalities have different minimum wages. Well, we were releasing this report just as we were realizing that everybody was going to pay $15 to $18 an hour for any job in the entire country. So we have put in our 4-year model in 24, raising that base to 15, and then in 26, raising that base to 18. And of course, dealing with the compaction issues so that we're, the percent difference between the person coming in base rate is not making 15 to 10 an hour, but that we're really recognizing and valuing the role and the experience of the educators, the directors, the family childcare home owners. So those are the things that, again, the model allows you to do. And you can also run other scenarios, working with advocates, working with policymakers. What do they want to better understand about the childcare system and the cost drivers? And what would those policy decisions, one that New Mexico has to face here in the near future, is looking at group size and ratio. Part of the big thing that's driving our high quality is that's where we finally get to more quality group size at 8 infants versus 10 infants or 12, I forget, Daisy, but but those are things of capacity. But through the process of doing the cost estimation model, you're able to educate your whole community about why these ratio and group size are important, how they affect your capacity to serve children, and how they affect your costs. So those are things I think are just so valuable about the cost estimation model process.
And can I jump in there on that process piece? Because one thing that I think we sort of leaped over in discussing how we build models is how stakeholders and providers are engaged in the process. And Secretary starting to allude to it there with that engagement of providers, discussion of what what their salaries are, what their expenses are. That's a huge foundational piece of cost modeling. It's a piece that's also required as part of alternative methodology under the federal CCDF, but even more important is it's just best practice, because this is the bread and butter. And for family childcare, small business owners, these are their programs that they have built, and Daisy can speak to building from the ground up, and they know how they operate currently. They know how they put it together and are able to keep their doors open, and they have to be part of the process informing the data that is in the model. They're part of the process of helping us understand their current reality of those expenses, but they're also part of the process of talking about what would you hire people at? What should you be paying? How would you be able to hire, attract, and then retain the workforce? Where do you need to be at to have those things happen? So provider engagement, and the reason I thought this was a really appropriate time to bring it up as a piece of the process is one of the reasons why the process of cost modeling, especially as you move into alternative methodology with it, is a time-consuming process, because there is about probably almost 9 months of deep provider engagement, from talking about the model, educating, asking questions about it, very similar questions to the types of things that are coming in during this webinar, and helping folks become more comfortable with it, because it's a form of change. And no matter what, even though if we think about how broken the rate setting is under market rate, change doesn't always feel good. And so we need to be open and consistent in messaging, and support providers to see themselves as drivers of the process, not something that's happening to them. And that's a really critical importance in the process. And then to have them really feel like that the information that they're sharing through surveys, interviews, other data collection methods is what is actually driving and informing the model. And again, not just that current state, because that's always something that folks get a little bit concerned about, is like, don't ask me what I currently pay people. I don't want to keep paying them that, right? I want the model to know. And we get that, right? We harness that as part of this process. And that's why we talk about it being not just this point in time, but this long game that a state is engaging in to do things differently, and that it's going to take time to make all the changes to do things differently, but providers have to be partners in it at every step of the process. And that data collection is such a critical piece of it, and hearing their voices in informing what should be next in the model. How does the model need to evolve in the next iteration that New Mexico runs it for rate setting? And that conversation is happening all the time as part of that provider engagement. And I know that that Secretary can speak a little bit more on that idea of advice to other states about how to engage providers too. So I'll turn it to her.
I'll let Daisy talk about that. Daisy, I think you can talk about the stakeholder, yeah, and how you engage provider, and how as a provider you were engaged in the process.
Well, as a provider, I mean, in regards to the cost model, I think that it's very, very important. I think this has been childcare has always been seen as kind-hearted. You know, my mother started childcare as you know, at her home with not getting paid. You know, I know a lot of people that started like that. It's a kind-hearted career or path that you want to take, but we do need to start looking at it as a career, as a professional career, because we need to give you know, professional outcomes. We need to give high quality care for these children. And so I know New Mexico, I'm so blessed that, you know, my childcare centers are in New Mexico. New Mexico's investment in finding the true cost of care is a game changer for our state. I highly encourage others to follow our lead so that they could too make educated decisions on funding the early childhood services. So this calculated, this worksheet that Mr. Simon created, you know, they also have similar worksheets around the state, but it is observing the cost of education for the teachers by providing, well, New Mexico is observing this cost by providing scholarships for the teachers. So it's also a partnership. It becomes a partnership within the child cares and the state. So they've created scholarships, they've created, you know, career pathway, so that we could start looking at more as a career, and you know, having these people that come in to work look at, okay, why, you know, I need to get educated, I need to invest my time in education, but also, you know, making sure that we're supporting these professionals, and that we're actually paying them, and that we see that they're growing educationally, and that we're actually funding and paying what they deserve. So I think that it's very important. It's a game changer, like I said before, and it's awesome. I really do feel that it is awesome. We need to really start putting ourselves as business owners, like real business owners, and really dig into our numbers, and not only just, you know, yes, we do it for a passion, we do it because we love it, but also looking at it into, okay, let's see what will cost me to give high quality and real high quality to these children and these families.
And Dave, you've done a fantastic job in growing your business and being an early Head Start childcare partnership. I think you even learned more about cost sharing and cost, you know, and I love the way you said a partnership between the state and our childcare providers, because that is truly what it is. As Gina described, our process was so robust We were able to sit, I mean, hundreds of stakeholders. Our cost estimation report lays out kind of all the different engagements and the numbers of individuals who came there and helped the state do a better job in informing what was driving so many of the costs. Things we understood. We worked with our licensing team. We worked with our quality team. So it really brings the whole childcare system together to take a hard look at what we're doing. And then you can't make all the changes all at once, but you do use the cost estimation model to inform your rates initially. But there is so much more in that model that helps you inform policy, practice. And again, because you've engaged your stakeholders along the way, everybody's educated about what the model is and why we're using it and how it can be used. And so I think we're further along and we have to keep using it and keep improving it. But it is only through that partnership with our childcare programs that we're going to be able to do that effectively.
So let's jump in and field some of the questions from the viewing audience. Secretary, when Simon sort of kicked this off, he laid out the case that this is an incredibly logical way to go about funding childcare, but the reason that maybe more have not is that there is a cost, and in some cases a significant cost. So Adele has a question in the chat here. When the cost estimation was released, I guess, did you experience any sort of sticker shock among policymakers? And if so, how did you manage those expectations? And also, how are you managing the expectations? You just mentioned that you can't do everything all at once. How are you managing providers' expectations now that this is out in terms of how quickly they may see relief?
Thank you, Adele, for that question. I'm grateful that I have an amazing governor, Governor Lujan Grisham, who is fearless and visionary, and she was absolutely for this from day one to create a universal early care and education system. So I worked with my fiscal people and said, what's in our discretionary, what is available still that we can put forward towards rates, and we saw what the difference was between what the cost estimation and where our current rates were. And so I said, as far as we can go, we're going, and there was some concern, discretionary funds are 3 years available. I did the same thing in DC. I spent a lot of it, but, it was listening to provider voices saying, we can't go on like this. We can't continue to serve children and not have enough funding to do it. And so similar here, I think our legislative finance staff were a little taken aback by how significant the rate went up. I thought the providers would be happy, but they felt that it should have gone higher. And so, navigating some of that, and our family childcare, we thought would be thrilled. But part of it was we'd been given a lot of relief dollars during the pandemic. So we'd been paying on every contract additional incentives. So that, I think, was a little bit harder, because I think what maybe people were hearing is that we were going to do that and increase the rates, but continue that $200 on every contract. So we had some messaging challenges there, but overall, I would say now, and Daisy she's more in the community with the providers, that I think we've gotten to the point where everybody understands this was the beginning. This was a shift, a big shift from a market rate to a cost estimation. And we set our rates based on, again, the best information we had available and the funding that we had available to get us close to that cost. And I would say in family childcare, we got, I think, at 100% to what the cost was. And in centers, it was around 92, 93% of what the costs were. Again, different ages and different settings and different levels of quality all comport. So I think that was, we did get, I think people were excited. People knew we were going in the right direction. The legislative people were a little concerned. How are we going to continue to afford this? And providers, I think, maybe thought they would have been a little higher. Now, and I'll turn it, Daisy, I think people all know that we at least have the tools now to continue to move in the direction we want to go. And we will continue to look for opportunities to increase those rates and maintain our cost estimation model, so that we know that those costs, with inflation, as Daisy said, with salaries going up, that the costs will also go up.
Yes, definitely. And I think providers are understanding. The big thing has, as I had mentioned prior, but the big thing is really understanding your business and really understanding your numbers. And so whether if it was whatever percent it was of an increase, too much, too little, whatever it was. Sometimes we don't understand it because we don't understand our numbers, and we don't know if it's a lot or if it's a little. But I think the most important part is, as providers, we need to sit down and we need to take accountability to understand our numbers and how it is that they impact overall our business. And so I think it's important. I think there's growth within business owners and within providers that I have spoke to, and they're happy. I mean, they are happy that New Mexico has chosen to take this, cost modeling, the cost modeling creation that you started here in New Mexico, because that really actually did lead to that 4-year financial plan that you just talked about, and that will, really allow to truly assess the cost of care going forward. So, that's where we're going to be seeing the increases of funding and creating long-term sustainable foundations.
Casey, thank you. Gina, a question for you. I referenced if Build Back Better or some iteration of Build Back Better comes to pass, they are envisioning that this would become the method that states would use to set new rates. As states begin looking at these cost-based models, Matthew is asking in the chat, what are the most important things that we need to ensure that state legislators and other policymakers understand about this process?
Oh, there's a lot. So let's think about the most important things. And this is also one that I definitely want the secretary to jump in on too, because doing a lot of educating with elected officials has been one of her jobs. And sort of probably the thing that we often have to answer is to talk about, we have to start with education on why it's broken, because it's very confusing to function in a state and know that you have childcare as an industry and years of childcare operating in your state, and then to be told that they don't have enough money if you don't understand how rates are set, how that current system functions. We work with many states and communities where the market rate or the price is referred to as the cost of care. And so you have to really understand the context that the individuals are currently operating in, because if they're working in a setting where they refer to that subsidy rate as the cost of care, and now we're going to come in and talk about the true cost of care, even if you put that word true in front of it, it doesn't help change that individual's mindset of, but I spent years understanding that this is what childcare cost in my state. This is what the industry looked like. And so we really have to, and Elizabeth and I have talked about this, is it's a very steep learning curve, right? We're taking someone from believing that while they understand that individuals are not making enough in that industry, they don't understand how kind of foundationally broken the idea of how rates are set compared to then, and how they're driving whether or not an individual is able to balance their books or pay a living wage to employees, right? They don't have that nuance. So part of it has to be sort of trying to quickly set the stage on what is broken and how there is a solution to fix it, and why that solution to fix it is more equitable and would incentivize quality and hopefully more access to care for children in the communities too. I think that's an important thing that anybody would ask, and it came in the chat too, right? This question of, if it costs more money, then are we going to have less children having access to care? And I think as a policymaker and elected official, your concern is that you're telling me that we have all this issue of access. Why would we do something that would make our access issue bigger? So then we need to do more about what are the policies and the changes we're going to make to address not just quality and the true cost of care, but also access at the same time. And New Mexico's long-term planning for the implementation of the new early care and education system really speaks to that idea of saying, okay, how do we also put money into more infant and toddler care and build up those slots, build more facilities that have infant and toddler settings or care in their setting, so that we're not just kind of undermining one side of our coin here with access because we're focusing on quality. We need to be thinking about both at the same time.
Exactly, Gina. And I think, we're fortunate here in New Mexico to have an enlightened group of legislators and staff who work with the LFC who care deeply about early childhood. And I think what the cost estimation model was able for us to do is to take that to exactly what Gina was saying. Like, we're funding this, we have these programs and services, but what, we sometimes see in their reports, like, well, staff are still not making good wages, directors got more and staff didn't, and we increased rates. So it's helping understand, yes, this is why, because even though we do have these great rates, you can see that the time out of classroom, the need for substitutes, insurance, all the things that drive their costs are not necessarily being covered. And so business owners like Daisy and so many others across New Mexico are making these trade-offs to keep the doors open, to keep the quality high, to be able to serve families. I think my favorite hearing maybe to date was when we were in Taos, New Mexico for an August hearing, and I was able to share the cost estimation model. It had just been released in June and July, and I was directing the legislators from the Legislative Finance Committee to kind of see what was going into it. And they started looking at the nuts and bolts, and they're like, well, how are you going to get good people here for $12.10 an hour? How are you? And they should be 18. They started bartering for how much we should be paying early childhood professionals. So it was a great moment, but it's like they had finally the information in their hand to understand what was driving the costs and what assumptions are going into how we're providing for families and children. So I think we got as high as $24, $25, should be the minimum to work in early childhood. And so it was a great moment. And I think the legislators felt very supported in having this kind of information and being able to understand at a more, because they look at budgets, they're looking at, funding sources, what we're using it for. And so as we were able to, through our cost estimation report, give them that level of detail and transparency into childcare, I think it's been helpful. And I think it's been helpful for childcare providers and advocates. We're all now using this very informed by providers, transparent document about what's built into our assumptions. And then they can ask good questions.
Allison asked an interesting question in the chat that I know, Simon, you had weighed in a little bit on in writing, but was asking about the criticism about, if childcare subsidy rates are raised, what will the impact potentially be for tuition-based families who are paying, and as childcare providers are paid a higher rate, does that translate to a higher rate for families who maybe are not eligible for subsidies? Secretary, have you what has your experience been in DC and now in New Mexico on that topic?
Well, I know it. I mean, in DC, the cost of care was enormous. It was way exceeded. I mean, because again, the supply was so low and so limited. I can speak more to here, which is why the governor felt so strongly that as we raised rates, that we also expanded eligibility. So I think our next work is, and I've got some good work happening. It's in my inbox to review is the co-payment structure. Because that clearly has to be looked at within this context. We just didn't have time to do it all at the same time. And co-payments, as many of you on the call know, are very complicated and complex structures that feed into this system. But expanding to 350% eligibility, we are looking now, can we use the relief dollars to even waive the co-payments for families above our eligibility? Prior to that was $200 at entry, $250 at exit. Now it's $350 at entrance and $400 at exit, again, through 2024, September of 2024 with the relief. So we're looking at that, but it was exactly that conversation, Dan, is we don't want to price out people. And then I think the other thing that we're seeing is that our providers have not been able to really charge what it costs them. So there's a lot of education that has to happen. And I think families are an important part of that audience. I'm really glad to see that you have Parent Nation next month. And, we have to bring their education along too, to understand what goes into, they drop off their most precious thing they have in life every day at a childcare provider. And for them to understand what is actually going into that care and what that costs, I think is an important constituent and a stakeholder that we want to make sure we're partnering with.
Absolutely. Question in the chat that seems like a Gina and Simon question. As you are working with finances of these state early childhood models, what do you see as the impact of the CARES and the ARPA dollars that are coming down from the federal government at this point? And Trell's asking, are there lasting concerns that state governments are going to have a challenge meeting the gap when those funds end?
Yeah, I mean, I think that is a concern we've heard from people saying, you know, where should you be directing one-time funds? I mean, I think it's great that New Mexico sort of acknowledged that, you know, there was this crisis right now and we needed to get money into the pockets of providers, right, and the workforce and actually support families directly. But I know a lot of states are really concerned about, you know, making that change when the funding is time limited. I mean, I think, you know, there are two answers to that I tend to give. One is that, you know, thinking about what can you do with one-time funds. And one of the great things to do is build a cost model. Even if you aren't certain that you are going to implement any changes with it, you know, I think what we were just hearing then from the secretary and others about data, you know, we love data, and, you know, having the data to be able to show why does childcare cost so much but teachers make so little, right? Which is the fundamental question that comes up so much in this space. If you have a cost model that's informed by a stakeholder engagement process, you know, that takes time, it takes money and resources to actually do that process. And so, you know, even if you don't know what you're going to do with it yet, you know, I've been telling people, you know, use some of those one-time funds to at least get that better understanding of the true cost of care. And then you know, maybe you aren't able to do what New Mexico did and move there straight away, but you can do some targeting of resources. You can make sure that you're targeting those one-time funds to the places that have the biggest gap between cost and price right now, which are the ones that are most in need. I think the other thing is, like, we're at a really pivotal moment for childcare in this country, right? That, like, even in just the last few years, and the one thing that COVID has shown is just how critical childcare is to a functioning economy. And so I think we're even in a different place from where we are 2 years ago when we first started working with New Mexico, of you know, the recognition of how much money it costs to do this, the imperative to invest in this. So, you know, all that's to say, I think, you know, I'm pretty kind of optimistic of, like, make the case and, you know, push to try and get the money, you know, and that we have a more receptive audience right now if you've got the data to make the case to put the money in there long term.
Great. And Gina, I see you're answering in writing, but I wanted to lift up Martha's question here on the full broadcast. She's asking what practices can be put in place to prevent equity gaps as rates are tied to quality tiers.
I know I did, Dan. I did type an answer to Martha, so hopefully everybody has a chance to look at it. But just quickly, and then I do want to turn it to Daisy and the secretary to speak to this one too, as on the ground in the state directly. And I think it has a lot to do with thinking about things like looking at QRIS and really understanding its implementation and ensuring that it is not an equity issue of who can succeed in QRIS, and that you really kind of rejigger that system to be more reflective of what quality looks like. But one of the things that I thought was important to raise up was that it's not happening in a lot of places, but there have been a couple states that have said, as part of a contract approach and knowing that we want higher levels of quality, we should pay that higher level of quality to the program now while they're pursuing it. Because to expect that they're going to be able to find a way to build their capacity, pay people more, make sure that they don't have staff turnover because of low wages, that's going to be tied critically to that quality, to do that all on what they're currently paid is unrealistic. That it's really sort of only a few that have been able to achieve that. And not to say that we don't want to continue to support those programs that have achieved it, but we also need to be thinking about really meeting programs where they are and bringing them along that continuum of quality. And so it really is about that state system response to it, not just the rates that are paid to providers.
Daisy, Secretary, any thoughts you want to add?
So I think a lot of childcares, a lot of programs do want to raise the quality and do want to improve in the quality, but it does cost money, and it does, you know, we need support. And so, you know what, I'm blessed to be in New Mexico, like I said before, and we are getting that support, and we are right on the great path. So I think, I mean, it's just really listening to providers and really following through. I think following through with what really drives these costs, like it's been mentioned all throughout.
That's right, Daisy. And I think too often we saw some of our largest increases were in our lower tiered centers. And I think that was also a surprise for legislators. Like, why are we not incentivizing? They're never going to get to quality if we're not giving them enough money to meet the basic health and safety requirements that are outlined in our licensing regulations that are expected of any licensed program in the state. And so I think that's another part of the conversation you have to be prepared for. And Luckily, most of our kids are in the 4- and 5-star centers that are in subsidy, but still, if we're going to grow this industry, we have to start. Health and safety is part of quality. Let me just say, you don't get to quality without health and safety, and that has to be funded. And we cannot expect providers to make that happen without providing them the resources that they need for those basics. So those were the largest increases in our rates were in our lower tiered centers. And I think we saw the same thing in DC as well when we first did it as well. And I don't know if that's continued, but thank you so much for the opportunity to share our experience, and really encourage you all. You can do it. It's good for families. It's good for kids. It's good for our childcare businesses.
Well, Secretary, thank you as well for all of the ways that you are leading in this field. It has been such a treat to watch all the progress that New Mexico has made in a very short period of time, just a little less than 2 years since the launch of the agency, and just the number of times that we are flagging all of the innovations that are coming out of New Mexico is really remarkable. So congratulations on all the success that you're having there. Daisy, thank you so much for joining us. Simon and Gina, the work that you're doing is so important and will continue to be, particularly as more and more states are moving in this direction. So we are grateful to all of you for joining us today, and especially grateful to all of you for taking time out to join in this conversation. Hope that you'll be able to join us. We'll be back on Tuesday, March 1st. Dr. Dana Susskind will be talking with us about her new book, Parent Nation. April 5th, we'll be back to talk about mixed delivery pre-K. And just a special flag, we're going to have a special session. We'll have more details to come on Tuesday, March 29th, connecting higher education and the early childhood workforce. So hope that you will register and join us on all of those. And again, panelists, thank you for taking time out to be with us today. Wish everybody a great afternoon.
Thanks, Dan.
Thank you.